Hi, Assalamualaikum. Have a good day everyone. My friend and I would like to present about first aid and emergency planning. Me as Qhairulnisa and my friends Ayu, Shafeekah and Amirul. Introduction. First aid is the provision of initial, immediate and on-the-spot treatment to victims of an accident or sudden illness. It is usually performed by a non-expert person to a sick or injured person until to take care of medical treatment for medical personnel. Certain self-limiting illnesses or minor injuries may not require further medical care, only require first aid interventions. The definitions of first aid is immediate treatment or care given to a victim of an accident or sudden illness before qualified health personnel attend to provide treatment. There are many situations that may require first aid, and many countries have legislation, regulations, or guidance which specify a minimum level of first aid provision in certain circumstances.
I will proceed to explain about the scenario that related to first aid and emergency skills application. Scenario 1 is on a hike at extreme elevation, an adult leader starts to experience headaches, shortness of breath, and dizziness. He then falls to the ground and throws up. How to handle this situation? Usually, hikers who travel to high altitudes sometimes can develop acute mountain sickness, or other name for this sickness is high altitude pulmonary edema or altitude sickness. It typically occurs at about 8,000 feet or 2,400 meters above sea level. This sickness generally are mild and heal quickly, depends on person. In rare cases, altitude sickness can become severe and cause complications to the lungs and brain. Higher altitudes have lower levels of oxygen and decreased air pressure. When you travel in plane, drive, or hike up on a mountain or go skiing, your body usually may not have time to adjust, so altitude sickness will easily develop. So next, I want to explain the most general signs and symptoms that body can develop when have to get through the high altitude situation. So, if you have mild case, you will experience like nausea and vomiting, dizziness, headaches, irritability, a loss of appetite, and maybe experience a shortness of breath with physical exertion. Lastly, here are the examples for symptoms of severe altitude sickness, which are coughing, chest congestion, inability to work, or lack of balance, pale complexion, and also skin discoloration. If you experience of any severe symptoms, call 911 or seek for emergency medical attention as soon as possible. It's much easier to treat if addressed before it progresses.
Today I want to explain to you guys about the prevention of altitude sickness. You guys know what altitude sickness? Altitude sickness describes several symptoms that happen to our body when the body is exposed to a higher elevation in a short period of time. Altitude sickness comes when people traveling, climbing, or are transported to a higher elevation quickly. It shows that the higher you climb, the lower pressure and oxygen you will get. But don't worry, our body can handle it, but just need a few time to adjust. So here are the tips for prevention of altitude sickness. Firstly, you need to climb slowly. Our body needs about 2 to 3 days of slowly going higher. Avoid flying or driving directly to high altitudes. Pick a lower altitude to stay up for 24 hours before going all the way up. The second one is eat carbohydrate. When you are at a higher altitude, you need more calories, so pack plenty of healthy snacks, including lots of whole grains. Each carbohydrate can give you some energy when climbing and hiking. The third one is avoid alcohol. Avoid drinking, smoking, or taking sleeping pills during your trip to higher altitude. If you want to have a drink, wait at least 48 hours to give your body time to adjust before adding alcohol into the mix. Another one is drink water. Staying hydrated is also important in preventing altitude sickness. Drink water regularly during your climbing. Next is sleep lower. Altitude sickness usually get worse at night when you are sleeping. It's a good idea to do a higher climb during the day and then return to a lower altitude to sleep, especially if you plan on climbing more than 1,000 feet in one day. So that is the prevention, and we will proceed to the first aid management. Now we continue with first aid management. First, we need to treatment. First, stop, rest, and allow the person to make a fully recovery. Continue to climb, but descend immediately if the symptom return. If problem persists for 24 hours, descend to a safe area where medical help is available. And the second one is descend to lower altitude. For acute mountain sickness, if symptoms do not get better in 24 to 48 hours, or if they get worse, the patient should go down to a lower altitude and seek immediate medical care. Another one is see a healthcare provider. If mild symptoms persist after descent, call a healthcare provider. For severe symptoms, the person should see a doctor as soon as possible. So that's all of the first aid management. Thank you.
Scenario 2. On a walk through your neighborhood with friends, you find a man lying on the ground under the ladder. He is in obvious pain and his arm is clearly broken. With a piece of bone protruding from the skin, how to handle the situations? According to the culture of safety, the three most common causes of ladder accidents include 1. Selecting the wrong types of ladder. 2. Using worn or damaged ladder. 3. Incorrect placement of ladder. Next, sign and symptom. The sign and symptoms of a bone fracture will depend on the severity and locations of the injury. Generally, the symptoms include: first, a noise such as the snapping of bone may have been heard when the injury occurred. Obvious deformity such as a crooked arm, swelling, difficulty moving, bruising, altered normal line alignment, numbness in your hand or fingers, stiffness or inability to move, crepitus, the grating of the bone ends, loss or reductions of functions, discoloration due to bleeding, exposed fragments or wound.
And I will talk about prevention. So how to prevent? First step is take your time and watch your step. When climbing, please take your time because there are no incentive award for the speediest stair climber. So please be safe and take your time to get to your destination. Don't rush. Second, breathe. Stair climbing uses large of lower body muscles and provides a great cardiovascular challenge. Steady breathing throughout your climb will provide oxygen to your muscle and help to fuel them to move on.
Okay, this is the first aid management. First, we need to stop any bleeding. If there are bleeding, elevate and apply pressure to the wound using a sterile bandage, a clean cloth, or a clean piece of clothing. Immobilize the injured area. If you suspect they have a broken bone in their neck or back, help them. Stay as still as possible. Third one, apply cold to the area. Wrap an ice pack or bag of ice cubes in the piece of cloth and apply it to the injured area for up to 10 minutes at a time. Treat them for shock. Help them get into a comfortable position. Encourage them to rest. And lastly, get professional help. Call emergency number like 999 or 911. But this is Malaysia, so call 999 or help them get to the emergency department for professional care.
The conclusion is falls from leather and having bad health effect when hiking often result in significant injury. Simple safety measures may have prevented the majority of falls and acute mountain sickness. All of us hope that all the safety measures will be spread to the society and any injury will be prevented well. Thank you.